Hi everyone, it's Dr. Jeff Harris here with K. Harris Chiropractic and Wellness Center. And today I want to spend a little bit of time to talk to you about why we see so many babies in our office. I commonly get the question looking around and say, well, I see a lot of babies here, but I wouldn't even know if I should bring my baby to the chiropractor. So today I want to share with you the 5 main reasons why you should get your baby checked by a chiropractor. Now the first reason is looking at your birth story. How did your birth story go? Did it go exactly as planned, or did something change? I want you to start to think about, was any intervention started to be added in? Did your birth process end with forceps or a C-section or a vacuum extraction? Did your baby get stuck in the birth canal, or would it have an acyclical presentation or a sunny side up presentation? Do they have to try to turn your baby in the birth canal? And even going back to look into your birth process or your pregnancy, was the baby breech at any point in time? That's the number one thing. The number 2 reason that you should look at getting your baby checked is looking for a predominant head turn. Have you noticed that your baby considers one side their favorite, either the left side or the right side, having their head turned? The easiest way to check this is to look at your baby. If they do sleep on their back, check them in the bassinet or on the crib. Do they always seem to keep their head one way versus another? Or if you think about them in the car seat, do they always keep their head one way versus the other? If they do keep their head in that one predominant way, it starts to indicate that something might be going on in the upper cervical region that might have happened during the birth process, and that's very important to get checked early on as soon as they're born. Now the third reason why you may consider getting your baby checked by a chiropractor is especially for breastfeeding challenges. I would say of all the mothers that we see in our office, breastfeeding challenges is probably the number 1 reason that we see so many babies. This is especially true when you start to notice that your baby's able to feed on one breast versus the other. They prefer the right breast, they don't really like the left, or vice versa, however it is for you. And this also goes back into play at looking at the predominant head turn. If your head could easily turn one way, but it was hard and stiff to turn the other way, would you as a baby be more comfortable to turn and breastfeed on the other side? You wouldn't. And it was also harder to get a fuller latch and an open latch. That's the number 3 reason why you should have your baby checked. The 4th thing to look at is that how is your baby reacting? Do you find that your baby is very stiff, or do you notice that they're arching a back a lot? If we look at babies should be very relaxed, they should be movable, they should almost be floppy. And if your baby relaxes and kind of melts in your arms and you kind of hold that point, that's a good sign. But if you feel that your baby feels a little bit stiff, or they feel like they're kind of in pain, or they feel rigid, or they feel like your seat's arching the back a lot, that can be a sign of some nervous system stress. Some stress, especially if that correlates to your birth story, it is even more important to be able to bring your baby to get checked. And the 5th and the final reason why you should get your baby checked is that if you're dealing with challenges between colic, reflux, or gassiness, this is a sign that your baby's nervous system could be stressed, more stuck in that fight or flight system, which slows down the digestion process. If your digestion process is slowed down, then it starts to affect all these problems, and you might have noticed some of these other symptoms on the other side also. Now, if any one of these 5 signs started to cause you to think about something about your baby that it might be interested to be able to have them checked, an assessment for a newborn baby is very simple and it's very safe. What we do in an assessment is that really we're holding your baby, we're checking the individual motion to see how well the spine's moving, we're checking their hips, we're checking to see all the movement of all the joints and how they're moving. And then the second thing and the most important thing we do in our office is we do a thermographic imaging test. Non-invasive testing, so nothing goes into your child's body, but what it does is it's going to give us segmental points to look for inflammation patterns from the top to the bottom. That really starts to give us an idea of how well the nervous system is working in your baby, and if there's anything that we can do to be able to help your baby to grow and develop the best we can. If you'd like more information, or if you'd love to give your baby checked, we'd love for you to be part of our family here at the office. Again, it's Dr. Jeff Harris, K. Harris Chiropractic and Wellness Center. We're located in London, Ontario. If you're not from London and you live further away, my best solution for you to be able to find a chiropractor in your area is to ask around. Find out if there's someone out there that that does see a lot of kids, that does see a lot of babies. That would be my number 1 place to start. Until we talk again, hope you have a great day, and I hope to see you sometime soon. Bye for now.